solve these 2 white stones for 2 to 3 weeks. Then you're going to do x-rays again, see if that is solved. And it's usually pretty quick, sometimes 2 to 3, even sometimes a little bit longer, but some stones, depending on the size, can be pretty quick. And you can continue the diet a little bit, and then you're going to move to a diet that's going to be for prevention. So you can find, if you go to Petco, PetSmart, you see urinary health or UTH diets. So those are not prescription diets. They don't need to get prescription from the vet.
Well, good afternoon. Good afternoon. Hope everyone is enjoying a wonderful meal, and it is fantastic to see everyone, and for such a fabulous reason, to recognize, to honor, and really to celebrate Dr. Ralph Richardson as our 2026 Alumni Fellow for the College of Veterinary Medicine. And it is so fitting. And I know for many, there is little introduction that is necessary when Dr. Richardson visits our campus. But it is, I think, really a wonderful opportunity to learn from him and to learn about his reflection and vision. But as introductory information, it is helpful. I think that many know that Dr. Richardson, he wasn't actually born in Manhattan, but he grew up in Manhattan. And so this really is home for him. Earned his veterinary degree from this college in 1970, was in the armed services, and then went on to pursue specialty training in the American College of Veterinary Internal Medicine in medical oncology, and served very well in that capacity, and was at Purdue University for many years, and served as a valuable administrator in that program. And then he returned back to Kansas State University in 1998 as our dean, and served us so well in so many areas, and importantly helped to make changes to our curriculum, and importantly helped us establish the veterinary training program for rural Kansas that got started in 2006. So 2 decades strong and doing great things for this college and for the state of Kansas, and has really been such a valuable person across this campus. And so without further ado, please help me welcome Dr. Ralph Richardson.
Thank you, Beth. It's indeed an honor, a real sweet able to come back and see so many friends. Is absolutely delightful. As Beth has said, this is where I grew up. This is where I met Beverly. Bev's right over here. Wave your hand, honey. And celebrated 58 years of marriage this month. And so we visited with several people that you're experiencing the empty nest syndrome, and we'd look at each other and say, aren't we glad that we like each other still? You know, after the kids are out of the house, there's more to life. It's where I began to build my career in the veterinary college, and to be able to come full circle and come back here. What I want to talk about a little bit today is, the first part is just do some kind of reflecting, identifying some things that really changed me as far as my career is concerned. I have some classmates in here that would never dream that I would have been a dean. I was going to do, at worst, mixed practice, and maybe at best at that time, large animal practice. That was where my mind was, and life took me a different way. And some of those things then for my career were very relevant. It might be helpful for some of you in your careers when you either look back or look forward and see where things happen. And then after that, for a little bit, I want to spend some time identifying some current concerns for the future of our profession, and share with you some ideas that really emerged here at K-State that may be able to be pushed forward and see where we go as far as our profession. So, as I said, change was necessary. The places where really bumps occurred in my career was, first of all, going to veterinary school. And you build a relationship, it's like brothers and sisters, and you just have a great time together. It was Vietnam era when I was in school, so I took an early commissioning program, sign up, so that I could finish veterinary school and then go on active duty as a captain in the veterinary corps with almost 4 years of longevity, which made my pay raise a little bit higher. And then I was on duty for 2 years. I spent some schooling in San Antonio, in Chicago, and then spent almost a year at Fort Hood, Texas, and then a really changing experience. I got sent to Korea, to Daegu, Korea, where I lived for another year, and was in charge of public health and veterinary care for military working dogs and food safety. So that sort of thing was really a big impact on my life. When I was leaving the military, I didn't know where I was going to get a job. I was in Korea. I thought, what do I do? I was pretty confident about my large animal skills, but I was scared to death about my small animal skills. And I thought, I'm going to apply for internships in small animal medicine and surgery, and I'm going to use that to shore up my deficit that I had. So I wrote letters from Korea, and this is pre-cell phone days. This is, you know, that was a long ways away from continental United States. But I got a call from a guy named Jim Blakemore, who called me from Purdue University and said they'd like to offer me an internship. And I was able to bring Bev and our oldest son over to Korea to be with us, be with me during that time. And this phone call came in at Indiana time, working days, at Korea time, 3 or 4 o'clock in the morning. And Bev stumbled out of bed and she said, what's this call coming in? And I turned to her and said, honey, we got an internship. And we grabbed each other and we danced around and said, we got an internship. We got an internship at Purdue. And simultaneously, we pushed back from each other and said, where's Purdue? To me, it was an Ivy League school back east someplace. I had no clue. And I got there. Thankfully, I found a land grant mission. I found, just like K-State, only they had brick buildings instead of limestone. And we had so much fun. And it was a great, great year of enjoying other people, role model teaching in the clinics as an intern, and just had a big impact. And I thought, maybe someday I'll come back and teach. I'll practice for 15 or 20 years, and then I'll come back with the experience that I need to be able to teach well. And I'm going to do a residency program. And they took me on at Missouri, and I did a residency, and that was in the early days. There was just a handful of board-certified people in our profession in the clinical sciences. There were pathologists and people in the basic sciences that had boards, but clinical sciences weren't very well populated. But that allowed me to qualify for sitting for internal medicine boards. And so I went to private practice then. I was on my way, and I got convinced that I could go to the center of Miami, Florida, and I could do all the kind of things that I want to do in practice. And oh, by the way, if you want a quail hunt, which I like to do, there's places you can go outside of Miami and go quail hunting. I didn't realize it took you an hour and a half to get outside of Miami, but it was something that I was convinced I should do. And I got down there, and 2 things were present. One is I'd never really lived in a big city. And 2, I didn't know anybody. Oh, I knew one person. It was one of my former students who was practicing there. It was the first time in my life that I didn't have a peer group around me. And that was a time of really self-reflection. And we talked and said, you know, when was I the happiest? And so I called Purdue. And I said, what do I have to do if I want to get back into teaching? I was sure I'd have to go get a graduate degree, go back to school. I was willing to do that. And they said, well, by the way, we have an open position right now. Why don't you apply? And they hired me, and I was there for 22 more years. But that time in private practice, even though it was only 1 year, was a major change in what I did. So as a young faculty member at Purdue, first of all, I just started teaching. I was in the clinics. I was supposed to teach internal medicine, gastroenterology, oncology, pediatrics, renal medicine, and I'd read ahead before they go to lecture, and I'd get my lectures ready to go, and I'd have the medical artists create cartoons for concepts that I wanted to teach with, and I'd never been in the classroom. That was the first time ever. But I'd been in 4-H, and I'd learned how to give a talk, and I used my 4-H training to go into the classroom and teach. Oh, and by the way, there was a veterinary technician program immersed in the veterinary school. And I taught the veterinary technicians too. I just made it a little less intense than I did the veterinary students. And I'd show them lab findings, and they'd mark those. And I'd say, if I was in practice, I'd want to know what that was, and you could help point it out to me. And those kind of things gave me a great opportunity to learn about myself. And so I tried hard. About halfway into that time at Purdue, they asked me if I'd become a department head. I said, no, I don't want to do that. A year later, they came back, will you please become a department head? And we want to combine large and small animal clinical sciences together. And I'd gotten involved in building a program in cancer and a little bit of administrative work. And Bev and I talked, and we said, okay, we'll do this. Purdue has treated us well. We'll give it a try. And I got to do it. I said, I'll do it for 2 years. And if I don't like it, I need to go back to oncology. And 10 years later, I was still doing it and having a ball. And the dean had really helped. And then there was that move to Kansas State University. Again, a different environment than I had grown up in here. A couple of faculty members that I had were in the audience when I was giving my public presentation. But the facilities were different. The people were different. And I looked at that, and the first trip out, I thought, wow, there's some things here that would really be fun to work on. I think I could do some stuff. And I got invited back for a second interview, and it was just absolutely delightful. And we walked away from that. Bev got to come with me. And we walked away saying, boy, if we don't get an offer for this position, we'll really be disappointed. It really changed my mindset. And thankfully, Jim Kaufman, who's sitting right over here, talked with me on the phone. Early one morning, first thing in the morning, we were talking through how would this work, and we came to a verbal agreement, and I was coming back home. And I appreciate that in particular, because not only was he my boss as the provost, but he had been my instructor in equine internal medicine when I'd been in school. And that was really a special connection. I thought I was going to retire. 6 weeks before that, I was asked to take over the deanship and the CEO role at K-State Olathe Satellite Campus. Not veterinary medicine. It did have some animal health. It had some immunology. It had some pharmacology interactions. It had growing plants. What's the quality of the plants that you grow? Do they grow better if the quality on a hoop overhead compared to no overhead? And so here I was in a whole different area working on adult education. They had to make a change over there and asked me to do that. I told them I'd do it for a year, and I had so much fun, I did it for 4, and finally retired then in 2019. So before talking more about some of these defining events, I'd like to share some principles in life that have benefited me along the way, and they may fit you. I'm not saying you should or should not, but for me it was helpful. And one is, you never know what you're made of until you get your back against the wall. I was 30 years old. We were married and had 2 kids. We were buying a house in Lafayette, Indiana. It was an old farmhouse, and I think the price tag on that was $50,000. And this was 1976, and that was a lot of money. It was 5 acres and a great place to raise our kids. And why, I don't know, but I picked up the phone and called my folks. And I said, you know, that's a lot of money. You think we can swing that? What do you think about that? And that's when she said it. You just will not know what you're made of until you have to get yourself out of a fix. And I appreciated that. Another principle is that disappointing others doesn't feel good. I was a freshman at K-State. I was driving down Points Avenue. A high school classmate came up beside me and said, "You want to drag?" And I dropped the car down into low gear, and we took off. We failed to recognize that the sheriff was sitting right beside us. And he went around both of us and pulled us over. And we had to go to court. And again, this was 1965. I got fined $50. At that time, that was a lot of money. And I hadn't even started my summer job yet. And I had to look at my dad and borrow $50 to pay that fine. But in the meantime, he'd been back there just nodding his head while the judge was reading me the riot act. And I knew that I had really let people down in that regard. I didn't learn my lesson very well because as a young faculty member at Purdue, the associate dean for academic affairs called me in. And he says, "Ralph, I need to reprimand you." I had created a search committee to hire a veterinary technician for our cancer program. And I said, well, what did I do? And he says, "You went to this lady, we'll call her Patty, and you asked her if she'd serve on the search committee, and she said she didn't want to do that. She wanted the job. And you said you'd hire her right there on the spot. You can't do that. You've got to go through human resources. You've got to have the appropriate committee. You've got to have approval on that. And I was disappointed. I felt bad when I walked out. Hopefully I was learning a little bit about life in academia. Being trusted by others does feel good. It wasn't long after that our dean at Purdue, Jack Stockton, came to me and he says, Ralph, I know that you need this big piece of equipment to advance your cancer research program. I want you to know I'm going to buy it for you. And no way that we had at the departmental level the funds to do that. He says, I trust you. I believe that if I do this, it will be an investment in the future. And you can bet that I really did the best that I could with that equipment to develop, in that case, a hyperthermia combined with radiation therapy for treating extremity tumors on dogs and cats. Teamwork, so good when you have other people working with you. I met with your administrative council this morning. I was so proud of them. They meet together a couple times a month and they encourage one another. And that happens. Gordon Kopic and Bill Carlton. Gordon is a PhD veterinary pharmacologist from Kansas State, and Bill Carlton, a pathologist. The three of us started a journal club talking about cancer in animals and how that might compare to humans. And out of that little work, we got some money came to us, and we said, well, what can we do with this? And we started a cancer program. And it got more formal, and I'm going to go back early next month to celebrate the now director of that program, who is receiving an outstanding called the Moral Award. It is the founding of the land-grant institution that has the mission of teaching, research, and outreach. And Dr. Debbie Knapp is going to receive that one award from Purdue University for all the work that she has done with that cancer program. And it's just like watching one of your kids grow up and do well. Hugh Lewis was my dean at Purdue, and he had this bulletin board I've told several of you about. It said, wouldn't it be fantastic if ... And he had suggestion cards by that bulletin board. And it caused us to have aspirational thoughts and to think about the future and what could we do and do well. And that really inspired me. He was a great dean who didn't make it easy sometimes when we had these kind of harebrained ideas, but he supported many of them nonetheless. And then I've already mentioned this phone call. When I came to K-State, Jim Kaufman was provost. John Weefald was president. Dr. Weefald always said, when I hire administrators, I want to hire people that are smarter than me. I'm not sure that's the case for me. But he said, then I want to let them go and do their thing. And Jim, what a great boss you were. You encouraged me. You allowed me to make probably some stupid steps, but you also allowed us to try some things that hadn't been done before. And you said, how about this? And how about that? And boy, did we ever have fun. And it was just an absolute delight. And there's many others, too numerous to count. I could pick out a lot of people in this room that are part of that team of people who work together. Well, another big impact on me is the teaching that we had in our church. It's called Faith Bible Church. Faith Baptist Church. Now it's Faith Church in Lafayette, Indiana. Bill Good was the pastor there. And he had the amazing ability to take scripture out of the Bible and boil it down into just take-home lessons that you could apply in your life. And one of the ones he had was the 4 principles of stewardship. And he used the parable of the master who had 3 servants. And the master said, I'm going to go away for a while. I don't know how long I'm going to be gone, but I'm going to entrust my wealth to you. To one servant, he gave a bag of 5 pieces of silver. And to another servant, he gave 2. And to the third servant, he gave 1, and he went away. And after some time, maybe a year, I don't know, 2 years, he came back and he said, how have you been doing, taking care of my place? And he went to the 5 silver coin guy and he said, look, you gave me 5, I invested it, I've got 5 more. Here are 10 silver coins back to you. And the master said, well done. You're a good and faithful servant. And he went to the guy with 2 coins. And he said, look, here's my 2 coins and 2 more. I've made double the money for you. And he says, well done, my good and faithful servant. And he went to the one with 1. He said, how about you? He said, well, I knew you were a really crusty guy, and I didn't want to get in trouble. So I went out and buried that. Yesterday, I went back and dug it up, and here it is. You've got your 1 coin back. And the guy says, you lousy servant, I'm going to take it and give it to the guy that now has 10 because you didn't do what you could have done, at least even put it in the bank, safely earning interest. And those principles of stewardship then broke down to the fact that in this world, I believe that God owns everything. There was nothing that has been created without that leadership, that intelligent design to create all the things that we know about physiologically, pathologically, and more. He entrusts us with everything we have. That hit me real hard when he was teaching, because I looked down the pew and here were 3 little boys. And I looked at those guys and I thought, how well am I doing as far as being entrusted with those guys? Then he said, you can increase it or decrease it, what's been given to you, and then God can call you into account at any time. And I looked at those boys and I thought, what if I die tonight? What if one of them dies tonight? How well have I stewarded those boys? And I was able to really think differently. And beginning right after that, every Saturday morning that I could possibly do it, I would take one of the boys out for breakfast on Saturday morning. And they could pick anywhere that they want to go. They went to all kinds of cafes and hole-in-the-wall places all around within about a 25-mile radius of Purdue University. And we had some great times. And then our youngest son, Troy, he's sitting right over here with his wonderful wife, Christy. He always was excited about going out for breakfast on Saturday mornings, but I could just count on him. We always went to McDonald's and got pancakes. But it was fun, and we learned a lot, I think, about each other. Another really, I think, important teaching that was done by Pastor Good, Pastor Bill Good. I didn't say that. He was a Georgia country boy. He wasn't really sophisticated. Boy, did he ever study the Bible hard, and did he ever try to teach it well. And he took the scriptures from Ephesians 4, beginning in chapters 25 through 32. And in 25 it says, put away falsehood. And then a little bit later it says in 26, be angry and do not sin. Do not let the sun set down on your anger. Then he said, let no corrupting talk come out of your mouths, but only such as is good for building up as it fits the occasion. And finally he says, let all bitterness and wrath and anger and clamor and slander be put away from you. Sorry about that. Be put away from you, and be kind to one another, tender-hearted, forgiving one another, as God in Christ has forgiven you. And he broke that down into some very simple things. Be honest. Speak the truth. Speak the truth in love. Be current. Don't let the sun set on your anger. Maybe not literally. Maybe you have a fuss with your spouse or your significant other in the evening and you really are tired and you need to wait till tomorrow. But don't let it fester for a week or a month. Solve the problems when you can solve them. Attack the problem, not the person. Watch the words that come out of your mouth. You don't call them a fool. You can say what you did was foolish, but you try to be careful about how you label people, because once you label them, they may carry that for a long time. And finally, act, don't react. Let good things come out of your mouth. Don't be angry and bitter. Try to turn that thinking to something. What can I do positive? Even in this bad situation, what can I do? And I listened to your administrative council this morning. I asked them, what are some good things that have happened in the last little while? And every one of them had some great ideas and some great things that have occurred. And it's just that kind of thinking, I believe, and that kind of interacting with other people helped me dramatically as far as being able to communicate. Then finally, seeing life through other people, maybe it's next to the last, seeing life through other people's eyes. And my dear wife taught me that. If you're married, I'm guaranteeing you don't have a perfect marriage. There is no such thing, I believe, on this earth. And we had fusses and things, and sometimes we were pretty low, and so we went to seek some help. And a biblical counselor by the name of Dr. Bob Smith, a physician, sat us down, and we just had a great time to be able to visit with him. And pretty soon he turned to me and he says, "Ralph, are you seeing life through your wife's eyes?" Remember, I'm a young faculty member. I'm doing all these things to build programs. I'm teaching in the tech program and the regular program. We're raising 3 kids. We lived on 5 acres. And every time I went away, the sheep got out of the fence. And I didn't have enough money to put up a new fence. So I'd patch it a little bit, and it lasts for a while. And was I seeing life through my wife's eyes that was putting up with all that? I wasn't. And I learned that lesson. And even to this day, I'll say, "Whoa, wait a minute, Bev, will you help me see life through your eyes?" And it makes all the difference in how to turn things around. But, and then somebody's always watching. I talked about those 3 little boys. And those 3 little boys watched me. I came home one day and they had one of my pipes and they were smoking it and carrying on. I put my pipes away that day. I don't know what else they learned bad from me, a lot I'm sure, but they grew into 3 men. The 3 men that I most admire on this earth. And as life goes on, it's probably going to be, they're going to tell me what to do instead of me trying to tell them what to do. But they have wonderful wives. They chose well, and they're blessed with great families. Not perfect, but great families that are growing. So what were some defining events that happened? I've already told you what happened in private practice. I learned that I want to teach. I want to be in the clinics. I don't necessarily want to be in the classroom, but I will be. But I want to be in the clinics because I love having the light bulbs come on. When somebody's palpating an animal, and all of a sudden they feel a kidney, or they palpate and realize that cow's pregnant. And it's just, it's just a great thing for veterinary students to see that happening for us. A couple of years into my teaching, they had an honors award, the senior honors banquet, and they started describing this person that was going to get the Outstanding Teaching Award. And they said, and this person was born in Orangeburg, South Carolina. And I looked around and I thought, who else was born in Orangeburg, South Carolina? Who is this? And then they went on a little bit further and said that they served in the Army. Oh, somebody else did that. And then a couple more points down, I realized, wait a minute, they're talking about me. And I was absolutely stunned that I received 2 years into teaching what was then called the Norden Teaching Award. Now it's the Zoetis Teaching Award. But it caused me to really reflect and think, wait a minute, that's another area that I need to be a good steward of. And it encouraged me, and it led me to try to do things better. The biomedical engineering section at Purdue was great. They did a lot of cardiovascular experiments. They had dogs they would do heart transplants on, all these kind of things. And they came to me one day and said, could you take a dog and put some tumor cells under its skin and create a tumor? And I said, I wouldn't do something like that. What in the world are you talking about? And I said, it wouldn't even work. It just, that's wrong. And they went away shaking their head. And about a year later, they came back and they said, well, we realized we didn't really put a foot over into your arena as a clinician. But could we talk some more? And I became willing to put one of my feet over in their arena. And we started studying, and I talked about that hyperthermia machine. They're the ones that helped me understand tumor blood flow and ways to redirect blood flow pharmacologically away from the tumor, because their blood vessels are not normal enough to respond to the pharmacologic. And it's like somebody is taking a warm shower, and the next shower somebody turns on the hot water, and all of a sudden it becomes cold where you are. That's what we would do to the tumors. We would push blood through the rest of the body, take it away from the tumor, and with the external heat application, that tumor would get really hot compared to the rest of the tissue. And we tried to keep it so it didn't slough out, but it would begin to die. And we had some fun with that sort of things, and I worked with those people. And oh, by the way, I did end up having a dog come in with a transmissible venereal tumor. And I knew that that was supposed to be able to be transmitted during sexual intercourse or licking in dogs in places like Haiti. And I thought, I'm going to take a little bit of this. I aspirated some, and I did slide it under the skin of one of our long-term clinic dogs. And sure enough, he grew a little PVT under the skin. And from that, we could do other studies. We actually developed a model of putting tumors in the liver of neonatal puppies because once their immune system developed. And I had to really balance that out sometimes with it. Was it ethical? Was it right? How did we do? But I think we learned a lot about what could help people. There was one experiment we did called magnetic microspheres, and we would have adriamycin, a cancer drug, attached to little iron particles, and we'd put it down the artery towards the tumor, and we'd put a magnet over the tumor. And when those iron particles got there, they stopped because of the magnetic field. And the rest of the blood went on by. And you leave it there for about a minute and a half, and it adheres to the capillary walls and slowly leaches out the adriamycin. And we were curing osteogenic sarcomas with that treatment. It was amazing. We have a St. Bernardian, treated that distal radius osteosarcoma, and it went away. And we were getting ready to do the first 18-year-old man, young adult, for that tumor. And the people from the drug company came up, and they wanted to watch us do a dog, and all of a sudden the dog we were doing started having seizures. And then it had a stroke and died. And what had happened is little particles had gotten past the magnet, went to the brain, and caused a stroke. We did not treat that young man. And that particular study came to a close. Kind of disappointing that it didn't work, but very happy that we found out before it went into a person that we could stop it. And then the Purdue Comparative Oncology program I've already mentioned. We talked about compassionate patient care. We worked a lot with people that couldn't necessarily afford treatment for a dog with cancer, but we had external funding that we could find. And we did a lot of work with soft tissue sarcomas, lymphomas, osteogenic sarcomas. And we had literally every animal that came in, we would put it into a protocol to be able to treat it and capture the materials about that patient so that when we go back and look at the last 10 dogs, how did they compare? We were comparing apples to apples. We stratified, not only did we randomize the treatments, but we would stratify them so that big tumors were compared to little tumors. And it was just a learning time for me. I got to do a sabbatical at KU Med over in Lawrence, and I worked in the medical oncology department for a period of time following the physicians and learning how they did clinical trials. We just went back home and copied them. And at that time, nobody else around the country was doing that. So I just happened to be at a great place at a great time. I did learn that if you run out of money, soft money, what are you going to do with the people that you've hired? And so that was my first big lesson financially in a university setting. I told you that I finally became department head, and I found out that nurturing others was one of the nicest things that I could possibly do. I loved coaching our faculty members up to helping them pursue a career that was rewarding, that they were excited about. And when I left there, I was very proud of a department that could stand on its own feet, because whatever section you looked at, they were united and they were doing things together, and they had teamwork that was going on. The financial stakes were bigger at the department level than it had been in the cancer program, but we had to figure out a way to make things work financially. As I was a department head, I got involved in training foreign veterinary graduates. That was a revenue stream that nobody else had. These were people that wanted to come and practice in the United States, had been veterinarians in their home country, and the AVMA required that they either pass a big test or that they do a year of clinical training in an accredited veterinary school. Most of them wanted to do that year of training. We'd put them through the paces for a little while, some junior surgery lectures. We'd have some technicians interview them, and if they seemed to be coming along, we would let them matriculate right alongside the senior students. And at first I didn't know how that was going to work out, but it turned out great. every section started bringing food in to the rounds room, and they wanted to know what came from India and what came from different countries, and they would have a food day at the end of that particular rotation, and just had a great time. I had a picture of one guy putting a turban on one of our American classmates. I didn't know how long a turban was until I saw that picture. There's a lot of cloth in that thing, but it was just part of a culture that we created. I got involved with Veterinary Clinicians Organization, with AVMA. That led to helping to create the specialty of oncology. And I doubt if I could pass the tests today, but I got to be a charter diplomate in that one. And I already had my diplomate status in internal medicine, which wasn't a walk in the park. I passed the first part okay, but I struggled to get the second part done. But I'm glad that I learned how to study and get that all accomplished. Then when I came here as dean, again, working with others, the financial stakes are greater, but I have to credit the faculty members and particularly the administrative council as how we worked in this college to grow up career pathways for faculty members. I thought I was going to retire, and with 6 weeks notice, the provost asked me to take over the Olathe campus. Bev and I looked at each other and said, well, let's try it for a year. And as I said, we did it for 4 years with such a great time. It was more of like a family atmosphere instead of the big campus interactions that take place here. So that's kind of where I've been, and some of the principles and some of the events that have affected me, thinking about looking ahead. And I don't have a crystal ball. I don't know. But I think there are some things that we have to recognize for our profession. Ooh. In the clinical sciences and in some of the more basic sciences, pharmacology, places like that, it's really getting harder and harder to hire specialists because so many corporations are buying good clinics and they become corporately owned. If you turn the clock back 30 years, a small animal practice might sell to another small animal practitioner, and the sale of that practice would become the retirement income from the first person who sold. That could still be true. They'll have the money from the sale, but there is now a greater standard and a little further away management of those particular practices. So it can be challenging at the very least. I think as we look at what's happening with our new graduates, many of them just aren't interested in practice ownership or even being the medical director in a corporately owned practice. They don't want those responsibilities. They want to be able to have a better work-life balance. And they would love to find a job that they could work for 4 days a week and have 3 days to spend with family. And there's nothing wrong with that if that's what they want to do. I don't know what has caused that, but it may be generational. It may be our culture. It may be that we have a gender shift and our women are the ones that have babies. And there's times where they want to be with their babies and they want to have family for a while and then get back into the profession. And I think as a profession, we need to learn how to flex and roll with that in a way that we find solutions to the problem. I think we also are seeing more and more students go into the military, into public health, into regulatory medicine at the state level or the federal level. And we need to be thinking about that as far as what do our new graduates need and want when they're coming out of veterinary school, or what do they want to change after they've been out for a little while. A reality is that 70% of our graduates each year across the country go into small animal primary care practices, and 80% of that 70% enter a small animal practice, and almost all of them become employees. Of the ones that don't pursue private practice, they go into advanced training. Could be an internship because I just don't feel confident enough to go into practice yet. Or it may be an internship that I want that so I can get into a residency so I can keep growing. But there's a number of reasons why those internships are selected. And then they go on into residencies and then finally into practice. But about 20% of our graduating classes across the country go into some advanced training such as graduate degrees, and they go into non-practice careers. They may be in a basic science department, they may be in a pharmaceutical company, they may be in a number of ways. So what can we do? And I want to speak to what do we need here at a veterinary school. I think we need to be sure that we provide a base that allows veterinary graduates to enter an increasingly diverse field of work. They need to have diagnostic and technical skills that enter at an entry level to be doing those things. They've got to learn how to communicate, whether it's with clients or with each other in the practice or with your major professor if you're in a graduate program. That's important. I think that professional and ethical behavior is really, really something that we have to keep cheering on. We don't want to do things underhandedly. And if they aspire to be a practice owner or medical director, they need to understand a little bit about the finances and the engagement and how do they do that. Then they need to be willing to be a lifelong learner. The field is changing every moment. Things are changing. And if you think you're going to stay in one spot and do the same thing for the rest of your clinical year, you'll be left behind very quickly. We're seeing that public colleges are facing flat or decreasing state support lines. How did the veterinary schools deal with that? We increased class size. We increased tuition. We started pushing harder for research, bring in outside dollars. Let's hire more PhDs in the first 2 years of the curriculum and not worry about them being veterinarians because they understand the science and they can get the grants and we can really make that department do better. The teaching hospital and the diagnostic lab and other units are being challenged more and more to earn more money. It's a business. You got to be careful on how much you let the students do that the client isn't paying for. Those sorts of things. Other cost-cutting strategies is we have gone to less animal hands-on work in the preclinical year, and many schools are beginning to outsource more and more their clinical education to other schools around the country and around the world. Sometimes it's really difficult. I learned this morning that hiring dermatologists and radiologists and ophthalmologists is not an easy thing. If we can get them here to this school and let them see what we have, it's more likely that they would want to come here. But until they know what's here, it's hard to get their interest. And who's hiring them? All those corporate practices. And they want those positions in there so that they can provide all the specialties in their practice. I think we pretty well covered that. I should say philanthropy. This college is, the room we're in right now, is a recipient of great philanthropy. Over the last 11 years since I've been gone, this college has done unprecedented fundraising through gifts and sometimes in-kind gifts with things, not just money. Millions of dollars, millions and millions of dollars. Credit the deans, the administrative council, the people who have face-to-face contact with a client perhaps that could become a donor, but that is a big, big part of where we're going. There's a lot of colleges popping up. Some of the for-profit colleges, private colleges, they look at that and say, oh, that's a prestigious thing. That's a great thing for us to have. They see it as an opportunity to capture high tuition. They're going to focus on preclinical teaching, and they're going to send the rest of it out to be taught by somebody else. So if I were to be king for a day, what would I do as far as an ideal preparation? I would maintain a really strong preclinical program. You need a foundation on which to build. And then I would look for a core elective clinical program. I'll talk about that in just a second. I think it should be all species. I think you should have a non-practice elective available. I think that accreditation should be based on the core curriculum. Where does that primary setting take place? It can be in-house, I think. It can be the foundation. I'll talk just briefly about a controlled corporation if I have time here, but I'll look for somebody to wave me off if I'm going and need to quit, but I'll go quickly here. You can teach those diagnostic and technical skills, the business skills, the communication skills. The core courses ought to be medicine, surgery, radiology, clinical pathology, and necropsy, and then the specialties could be that oncology or ophthalmology or neurology. Let that primary care teach basic entry-level things. There should be non-practice electives for people that want to go a different route so they can get a running start at what their career might be. One of the problems with the current teaching hospitals is that we are run by excellent tertiary care specialists. I have been a board-certified clinician for so long, I want to teach my oncology to the students. I demand that it's be part of core. We can't do that. We're going to have to say no to some of those things so that we can get things done. It's expensive to run a teaching hospital. Clinicians are just about 25% efficient as far as their work is concerned. They're only on duty half-time. And when they're on, they're going slowly because they've got a group of students that are going along with them. And if you go into a private practice, and especially a practice, you're going to be on 90% of the time, and you're going to be seeing patients, and you're going to be generating a revenue income. Unfortunately, part of the treatment here is that treatment can become fragmented, and sometimes the residents get more attention than the interns, and the students are coming up last. That's not done often, but it's not particularly not done here. I know that our faculty care, but when we look across the country, that's what we're facing. So should we outsource that clinical education? I don't think it's a good thing. If you're going to go to practices, who knows who's going to own that practice next? Who knows what fight is going to happen around a technician and a student? How are they going to stick with that? So we better be a little careful about looking towards that path. Can a private practice work? Yes, it can. I want to give you an example of a controlled corporation, a 501c3. We had a board of directors that were majority Kansas State University faculty and administrators. We built a practice in Omaha, Nebraska that was available for clinical training. Students were there all the time. We bought a duplex where they could live, men on one side and women on the other, and they got great experience. They met the client when they came in the door. They dismissed the dog when it came out. They were there during every step of the way of the endoscopy, the radiology, the surgery, whatever it might be. That concept was developed by Dr. Roger Finland. The idea came from Dr. Jim Kaufman and Mr. Bob Krause. They said, what about this kind of a setting? It's out from underneath the university budget. The employees in the hospital are, we can hire and fire at will. We don't have to go through increased human resources. The salaries are market driven. We give them an incentive pay just like any other private practice for outstanding production, but we'll give them an additional incentive pay for excellent student work. The issues of promotion and tenure don't weigh on them. The pulling into the classroom doesn't weigh on them. It doesn't mean that they can't give an occasional lecture, but that is not their primary job. And they can focus on the practice, practice and teaching. So I'm going to I'll just click through here. There's some really nice things that happen with the controlled practice model, but we're probably out of time, and I want to say thank you very much for bearing with me.
Well, I want to thank you, Dr. Richardson. Again, congratulations. We are so honored to be able to celebrate your career and having you back on campus and really recognize all that you have brought, not only to the college, the university, but the veterinary profession as a whole. And so thank you so much. And we want to give you a very small token, but a little something. And of course, nice and purple, so that you can continue to celebrate all that you have brought to this college.
Thank you.
Congratulations.
Thank you so much.
Again, Thank you to everyone for being here. Please, if you have it in your schedule to be able to stay, please feel free to stay. I'm sure there are still some treats in the back. And we will have some time now with Dr. Richardson. And I will, from the research perspective, say that we've got an open house with the biomedical core facility. So thanks to Dr. Renter and Dr. Coetzee, and just great things happening all across our campus. Hope you have a great rest of your day.